so we'll get started now. So hello everyone, and thank you for joining us today. My name's Tom, and I'm Marketing Executive for the University of Liverpool's online programmes. I'm just going to give a brief overview of the webinar speakers joining us today, and then I'll pass over to them. They'll talk to you more about the Healthcare Leadership course that we offer. If you do have any questions throughout the webinar, please do write them in the Q&A section at the bottom of your screen, and we will do our best to answer them at the end of the webinar. We will also be offering you the chance to ask speakers directly your questions at the end of the webinar, but I'll provide more information on that later. Can I have the next slide, please? So introducing our speakers today, we are joined by Susan Buttress and Dr. Jennifer Johnson, who are Directors of Studies for the Healthcare Leadership Programme, and Gary Cochrane, who is an Admissions Advisor. Next slide, please. Today, we will be covering why we believe you should choose the University of Liverpool, discussing the Healthcare Leadership Programme, and then after that, Gary will give an overview of the admissions process and explain just how the student support team can help you throughout your studies. As I said before, we will also have time at the end of the presentation for a Q&A session. Next slide, please. So just a little bit about the University of Liverpool. It's proud to be known as the original Red Brick University, which was founded in 1881 and is a member of the Russell Group, which is 24 research-led universities. Some great facts about the university are that we are ranked in the top 200 universities in the world, associated with 9 Nobel laureates. We have over 20,000 online graduates since the year 2000 in all of our programmes. We also have a network of 270,000 alumni in 187 countries, and recently, in the Teaching Excellence Framework of 2023, the University of Liverpool was awarded Gold, which is the highest rating you can achieve. We do have a strong student community and try to ensure that our online students have a good level of engagement with their fellow students and teaching staff. The course materials developed by staff are designed for the online environment, and our programmes are much more than just a reading list. They are interactive, they are challenging, but there is also a high level of support from academics and our student support team to ensure that students are successful in their studies. Next slide, please. All of our online programmes are part-time and designed for you. The virtual learning environment is on demand and can be accessed throughout your course. Students who successfully complete their studies graduate from the University of Liverpool and are awarded a Liverpool postgraduate degree certificate, just the same as students who take similar programmes on campus. The online master's programmes offered by the university are designed to work around you as a part-time student, whether you are an international or UK-based student taking our courses on offer. And now, following that introduction, I will now pass over to Jennifer and Susan, who will discuss the Healthcare Leadership course in more detail. Over to you guys.
Thank you. So I'm Jennifer Johnson. I'm going to be talking about the individual courses that you can think about undertaking. Now, we have 4 options available for you. The initial one being the Postgraduate Award in Healthcare Leadership. We also offer a certificate, a diploma, and a master's, and we can tell you more about those later on. But those 4 options are available to you, and all of them are both at entry and exit points. Thank you. So the University of Liverpool Management School, we're accredited AACSB, AMBER, and EQUIS. Well, that only accredits top 2% of business schools globally. We are a leading centre of excellence for management education and research, and we have these absolutely outstanding links with businesses and public sector organisations, and indeed within the healthcare setting, a very wide array of locations that we can look at introducing you to as well. Thank you. Now, the School of Medicine was established in 1834, and that's at the forefront of medical practice and research and has been for over 180 years. So a very well-established school, world-renowned, and one of the largest medical education providers in the whole of the UK. So with our 2 schools there, the School of Management and the School of Medicine, you're in very, very solid, strong hands with a lot of expertise and experience to guide you. So let me give you some details about the course itself. The master's programme itself is unique in that it's interdisciplinary. It's jointly delivered by the management school and the School of Medicine. So saying again, that accreditation that we have, AACSB, AMBA and EQUIS, is really important to note within the fact that we are accredited in the management school. And also, as I said before, the School of Medicine is one of the largest medical education providers in the UK. The programme aims to advance your leadership skills, knowledge and behaviour. Understanding the interface between these is key to your success. So we're considering what you are like as a leader, both interpersonally, your character, and also the interdisciplinary nature of your leadership, understanding that you'll be working within a healthcare setting. We want to understand who you are as an individual and develop your character. And indeed, many of the people who've graduated recently talk about the development of their character. We also understand this interface between your knowledge and your behaviour. So you will develop very strong knowledge, obviously within the field, but also linking that to how you're going to behave in the field as well. And we understand the interface between these areas are absolutely key to your success as a healthcare professional. Now, many of you will be clinicians and you'll be thinking about how you're going to develop your professional nature and indeed your leadership and your management skills. And we really seek to contribute to that so that you develop the knowledge, you develop the skills and indeed the behaviours in order to contribute ultimately to improve patient care and healthcare systems and understanding, if you like, this interface between being a clinician and being a leader. I'll pass you now to Susan Buttress, who will continue. Thank you.
So good morning. So on the course, you'll develop the skills to make effective decisions using a pragmatic and evidence-based approach and a fit for the environment and social setting that you're based within. You'll learn also how to lead at an individual, an organisational and national level, and also have the skills to establish robust, appropriate and innovative leadership practices within the healthcare environment. So onto the programme structure. So the programme structure is made up of 15 credit modules and one work-based project or dissertation, a larger module. And all these modules have been developed by leaders in practice, both clinicians and non-clinicians, in association with the university. So if we look at some of the 15 credit modules in this list, we start with understanding leadership, what type of leader you might be. We then move on to leading strategic management and implementation of healthcare services. Leading complex change in healthcare settings allows you to look at the theories of how you might look at your existing practice and then how you might look at auditing that with a view to amending and changing. Leading people and teams in healthcare organisation is also an important module to develop your skills. Leading innovation in healthcare covers many of the theories of innovation and allows you to develop within your own setting, within the specific areas that you're working. The final two are modules, finance and quality management and safety in driving safe healthcare. Allows you to really put some of those skills into practice. And the finance also is very, very applied. Okay, so can we just move on to the next slide? If there are any other questions regarding the programme structure, we're very happy to take these at the end. So looking at learning materials, here's a summary. So you'll be covering a series of lecture casts, which will be complemented by reading lists and all the literature that is relevant for that particular week in that module. You will also involve practical activities that are applied to the theory and applied to your own situation. The use of quizzes, tests, and blogs also facilitates that process and also helps to build the community within your class in your online program. So you'll really get to know both your peers and from all over the world. So this makes it a really nice and rich learning opportunity. Next slide. So of course, assessment. Every program has to have an assessment, and we've made these as creative as possible and as applied to your practice and to healthcare leadership. These can be applied within your own organisation in your own country setting. And we've had a lot of really nice, good feedback from current students who have reported that this really allows them to understand the theory and to apply it. So, for example, there are discussion forums. We use reflective logs, so you reflect on your own practice and how you can then improve in the future. We will also be looking at presentations and really developing your skills in this area that you can then use within your own role. Obviously, we do have some assignments and written work, which really then develops your academic writing skills to take that forward in the future. And of course, in particular in the finance section, we also cover a lot of data analysis. It is really important. So I'm just going to hand over to Gary now, who will talk about how to apply. Thank you.
Thank you. My name is Gary. I'm one of the admissions advisors. If I could have the next slide, please. So I'll talk you through the admissions process. It is very straightforward. All we'd ask is that you obviously take a little bit of time to get your documents ready. But when you are ready to make your application, you do it online. The address is there, or you can go to the healthcare page itself. You can apply through the healthcare page. And on your application, you will be asked to provide photographic ID. So this is going to be a passport, driver's license, or possibly a national ID card, as long as it's got your photograph and your date of birth in. And for things like the passport, it's worth bearing in mind, it really does need to be a current passport. We'll also require an up-to-date CV or resume and copies of your educational certificates. So these will be certainly your bachelor certificates and maybe any other university certificates you have. These will need to be translated if they're not in English. One of the key aspects of the application form is the personal statement. So we do ask that you prepare a statement of between 300 to 500 words. And if you'd like some guidance on writing a good, strong personal statement, if you pop onto the website and go onto the blog page, you'll see that there is a posting there about writing a good personal statement. And then also we will require evidence of English language proficiency from our international students. Now, if you've got a current IELTS certificate that's within the last 2 years, that'd be absolutely fine, or something similar. If you don't, then sometimes it's worth double checking on your transcript of your degrees. If your transcript for international students states that it was taught in English, that's enough evidence, so that's absolutely fine. And if not, we can actually provide a free English language proficiency test once we've got your application and your other documents. And we as advisors, we can talk you through that and set that up for you. If I could have the next slide, please. Okay, so again, as I mentioned, the process is very straightforward, and we as advisors are here at any stage to either advise you, guide you, or answer any questions that you've got. So we're there at the beginning when you make your inquiry, and then when you are ready to make your application, you do that directly through the website. There is no cost to apply, so you can make your application and not worry about making any costs at that stage. And then once you've submitted your application with all your documents, it will come through to an advisor. We will review it. We may come back to you and ask you for further information, or maybe if a document is missing, or perhaps if it's not legible for some reason. And then once we're satisfied with that, we will put that forward and it will be reviewed. Now, this process is often a very quick and swift process, but at the same time, it can sometimes take time. So I would urge you that if you are making your application, please do it in good time, so that if we do have to come back to you, we've got plenty of time to work things out with you. Once your application has been processed and approved, you will be offered an offer letter, and along with that offer letter will be a payment plan. So this will be how you've opted to make payment for the program. And then in the offer letter, it will state that we do require you to basically provide confirm acceptance within 14 days of the offer. And then as soon as we have that confirmation, we can basically do the final step of enrollment and confirm that again with you. If we could have the next slide, please. So in terms of the programs, as already been mentioned, there are 4 programs within the whole healthcare. You can see the course fees down there for the current course fees for each of those individual awards. So when you make your application, obviously you will stress which program it is that you want, and you will identify the payment option that you want as well. But again, the advisor can talk you through all that. If I can have the next slide, please. In terms of the full MSc award, there is an executive scholarship currently available of 20%. So if you are offered a place on the master's program, you will then receive a 20% discount on the program fees. So this will take it from £16,065 down to £12,852. But please note that is for the full MSc award, not for the certificate or the diploma level only. Another little incentive in terms of the program fees are, and again, the advisor can talk you through this at any stage of the application process. If you, or maybe your employer, is in a position and they want to pay up front, they will also receive a 5% discount for doing that. Now, one of the last points there is the alumni discount. So perhaps you're not going for the full MSc award and you're just looking at, say, the diploma or the certificate, and you are a former University of Liverpool student, then you may be eligible for the alumni discount, which again, we as advisors would talk you through at any point. Now, I do just have to stress, you're not able, unfortunately, to combine the alumni discount with the executive scholarship discount. So if you are going for the full award, you will automatically receive the 20% executive scholarship discount. But again, as advisors, we are more than happy to discuss any of that with you at any stage. Thank you.
Thank you, Gary, and also thank you, Susan and Jennifer. That concludes the presentation today. So, like I said, we'll have a Q&A session now. If anyone is wanting to ask a question on camera, please do let us know in the chat and we will enable that for you. As we're using Zoom webinar, we will need to promote you to be a panelist to see you on camera, but it will only take a moment to do that. If you do want to ask your question on camera, your name will be, just please note that you and your name will be visible to everyone in the webinar and also on the recording. So please do just bear that in mind. Otherwise, if you don't want to ask a question on camera, that's absolutely fine. We just ask that you put your question into the chat or use the Q&A button, and we will be happy to read it out from there and answer it live. So do let us know in the chat if you want to ask a question face-to-face on camera, or if you want to remain off camera, so type your question into the chat or use the Q&A function. So we do have someone who does want to ask a question on camera, and I'll just try and get them up right now. 1 second, please. So Richard Haynes, if you'd like to ask your question, please.
Yeah, thanks. Can you hear me?
Yes, perfectly.
Great. Thank you, team. That was a really, really good presentation. Many thanks. And I've been looking at this for some time, actually. So I'm an obstetric consultant and the clinical lead for maternity at Liverpool Women's. And I've ashamedly been doing this post for about 12 months. And this is something I have been very interested in. I do have a couple of questions for the team. Just in terms of start dates, my understanding is that there's a few throughout the year. Is that correct?
Yes, that is correct. You can join at any point. There's an October start. There are four points, aren't there, in terms of starting? I don't know, Gary, if you want to expand on this, but you can join at any point. And of course, there'll be a certain number of modules that actually start at that point. So you can do, it is a little quite flexible. But Gary, could you just confirm those 4 points?
So the next intake is the 21st of May. So obviously, you know, that is a good start point. And then the next major intake will be the 8th of October. And then the next direct one after that will be early January, which we don't as yet have the date for. So there are generally 3 to 4 intakes during the year, but the next 2 available are the May and the October. And in concern to your question and what I've just mentioned about the executive scholarship definitely applies to the May intake. As yet, it would need to be confirmed for the October intake because that technically is a new academic year. So for the May intake, the executive scholarship does apply.
That's really helpful. Thanks, Gary. And another question I had was in relation to the choice of the course. So I'm obviously just conscious about the time that I can give to this, considering my clinical work. Is there an opportunity to register for example, the award or the certificate? And if I achieve the relevant modules, would I be able to upgrade, Gary? Or is it something that you have to pay in advance?
We do get this quite a lot with our applicants. They are sometimes a little bit tentative about jumping into the full masters. So yes, they can go for the award or the certificate, and then if they're prepared and ready for it, they can move up to the diploma and the master's level. But what would happen is, obviously, we would take them through the application process to get them on the program, and as they proceeded along the program, they would then work with student support and ourselves advisors, and then we would swap them on to the next level. So you don't have to commit to the full masters if you're not entirely sure you're able to, but you can progress up to the full masters.
Fine. And that presumably means that I wouldn't benefit from the 20% discount, presumably, as well, if I didn't register for it straight away.
It's slightly complicated. At first, you would not. However, then let's just say that you went through and did the certificate, and you had not at that point made a decision as whether you were going on the masters. You would not. But then maybe at a later point where you then did decide to opt for the masters, if the executive scholarship was still in place, you would get a prorated executive scholarship.
Okay.
What I would say to you is it all really depends on the timing that we do things, but the advisors would help you and basically explain what is and is not available at that point.
Okay. Thanks, Gary. That's really helpful. I'm a University of Liverpool alumni. I did my first bachelor's degree at Liverpool, so I'm hoping that I'll benefit from that as well. Can I just ask in relation to, so for example, if I want to do the PG certificate to start with, it's estimated around 10 months. Is that just an approximate time, or is that the time that you would expect me to be finishing things in that time, or could I do it in a shorter time? Does that make sense?
I can answer this one if you want me to. So basically, the program cannot be compressed because it is designed as a part-time program. So you go through one module at a time. So the timescale is the minimum time. We can, if required, build in study breaks to enable you to take a break for work or life reasons and then rejoin at an appropriate point. So you can extend it, but unfortunately you cannot compress it. So yes, the 10 months is the minimum time that you would be on the program. Okay,
no, that's great. And presumably there would be fixed times for the lecture casts. I'm just mindful about applying for study leave and getting time out of clinical work for that. Is it quite up in the air, or is it quite flexible, or are the times quite fixed?
Hi, Richard. I can probably answer that. Yeah, that it's completely flexible for you.
Okay.
So you can work your way through that. There are certain points, yes, where the tutor will try and get everybody together. But I think this is the reason, we've developed in this way so that you can fit it around your workload. Okay.
Okay, that's brilliant. Sorry, I've taken up too much of your time. I think I'll probably...
it's fine. I don't know if you want me just to talk you through. So the PG Cert and the PG DIP has different modules on it. So I don't know if you want me to, because I've got it open here. Would you like me to talk you through those?
That'd be really helpful, Susan. Thank you.
So of course your postgraduate certificate is 60 credits, and that is made up of understanding leadership, leading complex change in healthcare settings, healthcare finance, and quality management and safety in driving healthcare. So those are all 15 credit modules. And obviously, if you then decided to move into the diploma or move to the masters, you'd then obviously open up to those other modules that you'd then complete at that stage. Is that clear?
Okay, that's really clear.
Yeah.
That's great. Thank you very much.
And if I can add there, Richard, as well, I think we know from experience now, having talked to people and interviewed people who've come off the programme, how they've really found, particularly if they've been working in the NHS, a view from outside, if you like, being so important, and having a global vista in that they're mixing with students in their cohort from around the world. We literally have students from across the entire world. So it's really helpful to get different views and different perspectives. And that also feeds into the learning. So there is something about peer learning. A lot of that is done via discussion boards, which are not necessarily real-time discussion boards, but you can contribute at times to suit you. And the co-learning we found has been a very key component of the course, and also not seeing things from a myopic inward looking view, if you like, of healthcare from our own perspective, from our own healthcare, if you like, but seeing outside and learning from an academic perspective as well, which really is developing people's leadership afterwards.
Oh, absolutely. That sounds marvellous, Jennifer. Thank you. I'm probably asking a very silly question now. Is the course entirely online, or is there opportunity for any face-to-face peer things?
It's completely online. It's been developed to be completely online, although there are some times of coming together and interface together, but that will also be online as well. Yeah.
Great. Thank you very much.
Thank you, Richard.
Susan. I was just going to say thank you as well, Richard. Those were some really great questions, and I hope that they were answered sufficient for you. And I hope everyone else found them useful as well. We do have some other questions as well. So we have been asked that in regards to the PG cert, how much study time would be required per week on average?
So if you want me to answer it from an admissions point of view, we do stress to all applicants that they need to be prepared to put in 15 to 20 hours per week. So regardless of what level you join the program, 15 to 20 hours per week in order to achieve success in the program. And we do state that. So, you know, hopefully it helps them do their timetabling, maybe juggle their sort of commitments.
I think I'd probably just like to add that particularly obviously clinicians have extremely busy periods, and the program is designed as such that you can obviously squeeze bits into, you know, when you are less busy. I do know clinicians that certainly wouldn't be able to, you know, do a normal program, but this program allows for that kind of type of flexibility, because we're aware of, you know, how people work.
Thank you, Susan. Thank you, Gary. Another question is as well, again, in regards to the PG cert, said, I'm clinical and healthcare. Clinical and healthcare finance wouldn't be particularly needed for them. However, they would be keen on the 3 other modules. Is the finance module optional or mandatory?
I'll say something funny here. Susan Buttress and I were recently at a conference. We gave a paper at a conference, and we were there for 3 days with a lot of clinicians. And my comment was afterwards, there was no mention of budget or finance. And my view is, rightly or wrongly, that we need to have a good understanding of budgetary and financial issues across the entire healthcare setting, whatever our individual roles are. You might disagree, Susan, but we have made this a mandatory module. And I would say, and we've looked and reviewed, and I've just literally done some monitoring of that particular module, that the finance that you would be doing isn't the debits and credits. It's not the accounting where you're having to sit down with creating a balance sheet or a set of accounts. It's much more the useful side of this, in that we are looking at application, we're looking at organizational level. And so there is a real sense of understanding to any role that you have within a healthcare setting. I think it's good to have an appreciation and understanding of finance. And one of our students who recently completed is now finding herself talking to the top individual at the head of the organisation about financial issues, because she now has this ongoing understanding which she didn't have before, which she didn't necessarily believe was suitable for her role or necessary. So I guess I would say I would be on the side of the real importance of finance. So I'd be interested, Sue, about your views as well, about that, but not to be afraid of it. And certainly we're seeing very good response and very good percentage of success within that module, even with people with no basis whatsoever of finance understanding. I don't know if there's anything you'd want to add to that, Susan.
Yeah, I suppose it might, I'm not quite sure if we said this right at the beginning, but I'm the health and medicine end of the partnership, and Jenny is the management school end of the partnership, and of course we've jointly to develop this program, which has actually made it really quite special and quite different to anything that we've seen before, because it's very much integrated and very applied. So even though you may not, it may perhaps have the wrong title, it is about finance. But if you're looking at business cases, really trying to get new staff, develop new processes, then you really need that background. So as Jenny says, it's not the real hardcore elements of it. We really integrate it into how you can use it within your practice, and people have found that really useful. So I'm sorry I might have put you off with that, but if you want any other detail, then feel free to leave your details and we can get back to you.
Sue's commented there, that makes sense, and that would agree. So she's pleased she's not creating any accounts or adding up. We had recently our external examiner who was reviewing the work of our students, and they looked at this particular module, in fact, and he commented on how strong the presentations were. And the presentations were the analysis of accounts, the analysis of accounting, and what that meant in a business sense, if you like, to run an organisation. Because whether we're public sector or private sector, that in a sense we still have to work within these budgetary constraints. So I think, Sue, for your career, whatever your role is, understanding finance will have a huge impact, beneficial impact upon you and hopefully your career progression as well. And that's certainly what we're seeing. So hopefully that's helped that question. Thank you.
Do you have any other, do you want to reply to that at all?
Sue's put a few comments there, and so she's happy now that she's not creating any accounts or adding up. So now I think perhaps we need to increase our understanding and explanation of that, perhaps, Susan. Yeah, thank you.
Both, and also thank you, Sue, for the question. I'm glad that was a good answer for you and that helped. Another question that we've had is, I live in the UK. Will I have the option to attend graduation on campus upon finishing the course? And I'm not sure who wants to answer that, maybe Gary or even Susan. I see you've just unmuted.
Yes, certainly. You would be. Of course, people come from overseas too, so UK and overseas, certainly you'd be involved in that. As any, you're a student, a University of Liverpool student as anybody else. So yes, certainly.
Thank you. Another question is, how are the modules assessed?
That says particularly for the PG award, you've got the details of those two individual modules, haven't you, Susan?
So for the award, we have understanding leadership and leading complex change in healthcare settings. So for the leading complex change, then you would have an assignment. You apply it to your own organisation, your own setting. What is there something that you particularly want to be looking at changing? You'd be evaluating your current practice, looking at best practice, and that whole process within the assignment. And we also have a presentation for that as well. So the understanding leadership, Jenny, I don't know if you can explain the assessment on that one.
Gary might not have that in front of me. I haven't got that in front of me now. I know there's a reflective log about understanding leadership, and this is your introduction to leadership. So some of the theories of leadership and what that means and understanding how that relates to your individual practice. And the reflection is about you as a leader and you becoming a leader. So there's quite a lot of work there about you as a character, who you are, and how you're developing into becoming a leader. And I don't know if Gary, if you have the other assessment for that. If not, we can send that under separate cover to the students.
Sorry, I don't know.
Okay, well, perhaps if you can put your if you can be in contact with Gary and the team, we'll on that detail there. Perhaps even on that. Is there another email address that we best to put that question to, so we can respond, please?
Or you can leave it at the end.
Yeah, that'll be fine.
So
sorry.
Yeah,
Sorry.
so essentially we would guide you to the assessment. So there's a lot of assessment support that you have access to. So we don't just leave you to, complete the materials and here's the assessment. There's guidance, that's written guidance, but there are also people there for you to help with academic writing, with presentation skills, etc. So there's a big section of people there to help you. So I wouldn't be too concerned if you're coming back to master's study, as many people are. As clinicians, you've gone off and done your well within your careers. and you may not have done a lot of academic writing for a while. So I wouldn't be too concerned about that.
Thank you, Susan. Thank you, Jennifer. Richard asked a similar question in regards to the PG syllabus regarding the full MSc, and someone has asked, can I complete the MSc programme in less than 30 months?
Sorry, no, unfortunately. Like I said, we can't compress it, but we can extend it if you require extra time for whatever particular reason. But unfortunately, the modules are all studied linear, one after the other, and there just is no way for the part-time programme to be done in a quicker fashion.
Thank you, Gary. Another question is, can I take a study break? Is that possible?
Yes, it is. Yes, we can. And what would happen is if a student joins the programme and then for whatever reason they are requiring a study break, they would liaise with student support who would build it in and then build in the appropriate point for them to return so that they don't lose out. But yes, the short answer is it can be.
Thank you. And I'll come to you again, Gary. Someone's asked, do I need to pay a fee to apply for a course?
No, you don't. No. So obviously there is no application fee. Obviously you have to pay the program fees, or your employer does if that's the case, but you can make your application and then obviously, you know, we will review it and there is no cost. There is no cost up to the point where you accept and join the program.
Thank you. And another question regarding kind of the financing of the courses, can I spread the payment of the course fees?
Yes. So one of the things that we as advisors would discuss with the applicant would be how do they want to pay for their program fees? And one of the options that we would discuss is a monthly payment plan. So for the master's program, for instance, it's 30 months. So we would break the program fee up into equal 30-month payments, and it roughly works out with the executive scholarship of around £428 per month. So that's what the student would pay on an ongoing basis during the program. They would pay their first month as the deposit. So let's say they made their application a month or two before the start date, they would pay their deposit, and then that deposit would be used as their first month payment, and then they would carry on the payments from the second month onwards. Alternatively, as I think if you remember from the slides, you can make your payment up front. That can be done, and you'll get a small discount for doing that. That often appeals to employers who want to do it that way and reap that little benefit. But most of our students do opt for a monthly payment plan. And again, we're happy to talk them through that.
Thank you, Gary. Just got time for another question. And someone's asked, are the online master's degrees equivalent to their on-campus versions? And will the certificate highlight that it is an online degree?
From an admissions point of view, it's exactly the same certificate. I don't know if one of the others would like to discuss the other points, but it is exactly the same. It is just that you've chosen your method of instruction, you've chosen to do an online degree on a part-time basis. But if you're awarded a master's certificate or a diploma or an award, it is exactly the same certificate, and it doesn't state on the certificate that it's online or even on campus. It's just from the University of Liverpool for your healthcare program.
Thank you. I'm not sure. I see you unmuted, Susan. I'm not sure if you want to.
Yeah, I was just going to confirm that, really, that we don't make any distinction whatsoever. Thank you.
Okay, perfect. Thank you. And that's all we've got time for today. So thank you, everyone, for attending and for all the questions that you've asked. I do hope that the presentation and the Q&A session were all really helpful for you. Also, thank you to Susan, Jennifer, and Gary for taking the time to present today. It's really appreciated. And yeah, thank you again for attending. And a webinar recording will be sent out in the next few days of this in case you did miss it or you want to watch it back. So yeah, thank you again, and hope you have a great day. And yeah, bye everyone.
Bye-bye. Thank you.